Welcome to our channel. Today, we're discussing a very important topic, the warning signs of prostate cancer. Prostate cancer is one of the most common cancers in men, but it's also one of the most treatable when detected early. We want to empower you with the knowledge to recognize the subtle signs your body might be sending. We'll be diving deep into 10 warning signs of prostate cancer that you absolutely shouldn't ignore. Remember, knowledge is power, and early detection can make all the difference. If you experience any of the symptoms we discuss, please consult a healthcare professional for personalized guidance. Let's talk about the first warning sign, trouble urinating. You know that feeling when you really need to go but nothing seems to happen? These could be early indicators of prostate issues. As men age, the prostate can enlarge, a condition known as BPH. It's crucial to get checked by a doctor to rule out anything more serious. So if you're finding yourself struggling to urinate, don't hesitate to reach out to your doctor. Now, let's move on to the second warning sign, a decreased force in the stream of urine. Have you noticed that your urine flow has become weaker than usual? Maybe it's more of a dribble than a steady stream, or it seems to stop and start intermittently. This change, too, could be a red flag for prostate problems. Think of your urethra like a garden hose. A healthy prostate allows for a strong and consistent flow of urine, just like a hose without any kinks. However, when the prostate becomes enlarged or cancerous, it can constrict the urethra, similar to how a kink in a hose restricts water flow. This constriction can lead to a variety of urinary symptoms, including a weak or interrupted urine flow, straining to urinate, and a feeling of incomplete bladder emptying. Don't let embarrassment keep you from seeking help. By discussing your symptoms openly, you're giving your doctor the information they need to provide an accurate diagnosis and develop an effective treatment plan. By being proactive about your health, you're taking an important step towards living a longer, healthier life. Blood in the urine or hematuria is a serious warning sign. Not all instances are due to prostate cancer, but it should never be ignored. Blood in the urine indicates something is wrong in the urinary tract. It can be caused by infection, inflammation, kidney stones, or cancer. If you notice blood, consult your doctor immediately. Early detection is crucial for managing prostate cancer.
Seeing blood in my urine was terrifying, but seeing my doctor early was critical.
Early detection truly makes a significant difference. Chapter 4. Blood in the semen, a silent signal. Let's move on to the fourth warning sign, which often goes unnoticed. Blood in the semen, also known as hematospermia. While it might not be as visually apparent as blood in the urine, it's equally important to address. The reproductive and urinary systems, while distinct, share some common pathways. The prostate gland, situated just below the bladder, surrounds the urethra, the tube responsible for carrying both urine and semen out of the body. When the prostate becomes inflamed, infected, or cancerous, it can lead to bleeding within the prostate gland or surrounding tissues. This blood can then mix with semen during ejaculation, resulting in a pinkish or reddish tinge to the semen. While hematospermia can be caused by various factors, including infections, sexually transmitted infections, STIs, and certain medical procedures, it's essential to rule out prostate cancer, especially in older men. If you notice any blood in your semen, don't hesitate to schedule an appointment with your doctor. They can help determine the underlying cause and recommend appropriate treatment options. Chapter 5. Bone pain, when discomfort runs deep. Now, let's shift our focus to the fifth warning sign, which can manifest outside the urinary tract, bone pain. While often attributed to aging, arthritis, or injuries, persistent bone pain, especially in the back, hips, or thighs, can be a red flag for advanced prostate cancer.
Imagine your bones as the scaffolding that supports your body. When prostate cancer spreads, or metastasizes, it often travels to the bones, particularly those in the spine, pelvis, and femur. Cancer cells in the bones can disrupt the normal bone remodeling process, leading to bone pain, weakness, and an increased risk of fractures. If you experience persistent bone pain, especially if it's accompanied by other symptoms like unexplained weight loss, fatigue, or urinary problems, it's crucial to consult your doctor for a thorough evaluation. Early diagnosis and treatment of prostate cancer are essential in managing the disease and preventing complications.
Chapter 6. Unexplained weight loss, a red flag you can't ignore. Moving on to the sixth warning sign, we'll discuss unexplained weight loss. While many people strive to shed a few pounds, losing weight without making any changes to your diet or exercise routine can be a concerning sign, especially when it's associated with other symptoms. When cancer enters the picture, it can disrupt the body's delicate balance, leading to unintended weight loss. Cancer cells are like greedy invaders, consuming large amounts of energy and nutrients to fuel their uncontrolled growth. This energy drain can lead to weight loss, even if your appetite remains unchanged. If you notice a significant and unexplained drop in your weight, especially if it's accompanied by other symptoms like fatigue, loss of appetite, or changes in bowel habits, it's crucial to consult your doctor promptly. Advanced prostate cancer can release substances that affect the body's metabolism, leading to muscle wasting and weight loss. Erectile dysfunction, or ED, can significantly impact a man's quality of life. ED can be a symptom of underlying health conditions, including prostate problems.
Imagine trying to inflate a tire with a slow leak. No matter how hard you try, it never fully inflates. ED occurs due to disrupted blood flow, nerves, and hormones. An enlarged or cancerous prostate can damage nerves and blood vessels. Various treatment options are available, so consult your doctor.
Let's move on to the eighth warning sign, a painful or burning sensation during urination or ejaculation. While these activities are typically associated with pleasure and relief, experiencing pain or discomfort can be a sign that something is amiss in the urinary tract or reproductive system.
Imagine for a moment that you've accidentally touched a hot stove. The immediate sensation of pain is your body's way of alerting you to danger and prompting you to withdraw your hand. Similarly, when you experience pain during urination or ejaculation, it's your body's way of signaling that something is wrong. The urethra, the tube responsible for carrying both urine and semen out of the body, is a sensitive area prone to irritation and inflammation. When the prostate gland, located just below the bladder, becomes enlarged or cancerous, it can press on the urethra, causing pain or discomfort during urination. If you experience pain or burning during urination or ejaculation, it's essential to consult your doctor to determine the underlying cause. Early diagnosis and treatment of prostate problems can help alleviate symptoms and prevent complications.
Let's discuss the ninth warning sign, frequent urination, particularly at night. We've all experienced the occasional nighttime bathroom break, but finding yourself making frequent trips to the toilet, especially if it disrupts your sleep, could be a sign of an underlying issue. As men age, the prostate gland, located just below the bladder, can enlarge, a condition known as benign prostatic hyperplasia, BPH. While BPH is not cancerous, it can share symptoms with prostate cancer, including frequent urination, especially at night. An enlarged prostate can press on the urethra, the tube that carries urine from the bladder, obstructing the flow of urine and leading to incomplete bladder emptying. This can result in the bladder filling up more quickly, leading to more frequent urination even at night. If you find yourself waking up multiple times during the night to urinate, or if you're experiencing other urinary symptoms like urgency, hesitancy, or a weak stream, it's essential to consult your doctor to rule out any underlying medical conditions. Early diagnosis and treatment can help manage symptoms and improve your quality of life. Finally, let's address the 10th warning sign, pain in the testicles. While testicular pain can be caused by various factors including injuries, infections, and hernias, it's important to be aware that it can also be associated with prostate problems. The prostate gland, located just below the bladder, shares nerve pathways with the testicles. When the prostate becomes inflamed, infected, or cancerous, it can irritate these nerves, causing pain that's felt in the testicles. Additionally, some men with advanced prostate cancer experience pain in the testicles due to the spread of cancer cells to the testicles or surrounding lymph nodes. If you experience pain in the testicles, it's essential to consult your doctor to determine the underlying cause. While testicular pain is often benign, it's crucial to rule out any serious conditions such as prostate cancer or testicular torsion, a medical emergency that requires immediate attention. Early diagnosis and treatment can help manage symptoms and improve outcomes. We've covered a lot of ground today, discussing 10 critical warning signs of prostate cancer that you should never ignore. Remember, early detection is key when it comes to prostate cancer, and being proactive about your health can make all the difference. If you or someone you know is experiencing any of these symptoms, it's crucial to consult a healthcare professional as soon as possible. Don't let fear or embarrassment prevent you from seeking help. Don't forget to like, share, and subscribe for more health tips and information. Stay healthy.